What is normally looked at for postpartum depression and how is it treated?
I really love using the Edinburgh Postpartum Depression Scale, which is a screening questionnaire of, not sure exactly how many questions it asks, but every question is graded based on all the different things that go into, maybe it's just regular postpartum feelings, or if they score above a certain number, this is a flag to say this sounds like it's more like a postpartum depression. And the worst symptoms more have to do with, like, I'm not connecting with my baby, I can't get out of bed, and it's graded like, do you feel this way sometimes, the majority of the time, all the time, not at all, and then we add it up. And my medical assistants, that's part of their intake on everybody. We do it all the way up to about 6 to 9 months after a delivery at every visit that we see them, because now the evidence is really clear. Postpartum depression really could be up to a year where you would still diagnose it as being a postpartum depression. So, and while the majority of them come up within the first 3 months or so, you still could have somebody who thought they were okay, and then at the 6 month mark, they're just not coping, or something has progressively been getting worse. So if we use that scale or that scoring system and it flags, then we kind of put into motion things where a therapist, and as far as medication is concerned, if they were on medication before, I would tend to go quickly back to medication, because it seems that if they needed it before, they probably need it again postpartum. And it's not unusual to start them right at the delivery, like in the hospital, and go home with it. If they're resistant to it, or if they feel like they don't need it, then we see them fairly early, do the scoring system, talk to them about it, make sure they're set up with a therapist or somebody that they can talk to. And if the therapist, who is going to have a much more explicit or extensive conversation with them, feels medication needs to be added in, they'll call me, and then I'll be the prescriber, and then they'll continue to see the therapist.
I'm glad that you brought up the 1 year thing because I know a lot, like they kind of look at it like your first couple appointments right after, and then you're kind of like left in the
On
dark.
your own, yeah.
Yeah.
Mm-mm.
I hear about it too often online. I see too many people that, and they're like, my baby's 3 months or 4 months or whatever. And I'm like, you need to call your doctor.
Mhm.
Like, please just call your doctor.
Yeah, and depending on the trauma of the delivery, there's direct associations. If you have a preemie that ends up in the NICU, your chances of postpartum depression, whoop, go right up, because of all the things that surround NICU care, and what's going to happen when you go home, and maybe you don't feel equipped, and what about the baby stops breathing, and all this stuff that goes on in your mind. NICU care is one of the things that highly increases the risk that you might suffer from postpartum depression.
I wondered if there was certain things that kind of tip the scale, I guess, on one way or the other, you know?
Yeah, there's a list.
Yeah.
I mean, having needed medication prior, having had mental health issues prior, um, not completely supported in your relationship, or not having family support around you, NICU birth, traumatic delivery. There's a social situation, like, socioeconomic, if you're having trouble, caring for your family. COVID, of course, is on everybody's list now. So, but there's some very specific things that should flag the person taking care of the pregnant woman, the pediatrician, the providers, the postpartum nurses. Everybody fills out these scales all the time, and there are flags that they need to call us for.
So a pediatrician can actually see postpartum depression.
Absolutely. When if the mom brings the baby into a postpartum appointment, like an initial pediatric appointment, there's a lot that they can see just from, like, how the mom's interacting with the baby. Is the mom catching the cues of the baby? Like, when the baby is hungry or needs something and she's not able to see that is not always a baby problem. That is a problem of the mom not connecting with the baby. And sometimes that is a postpartum depression or anxiety thing.